Department of Public Health and Department of Education is seeing.
Just to follow up quickly on David's point about the masks.
Yep.
I know you've repeatedly said that you don't support a mask mandate.
Yep.
And one of those reasons is that usually in the same breath, someone will say, well, we're not enforcing it. Even if that's true and people
Yep.
defied a mandate,
Yep.
why wouldn't you just do it to send a clear, resounding message that, hey, like what you've said, Iowans, you'll help your neighbor by wearing a mask. Doesn't a mandate send a clear message and clear up any discrepancies or criticisms about, you know, do as I say, not as I do type of thing?
No, I don't think so. I think the goal is to do what we can to reduce the spread of the virus. I think the goal is that if you can't social distance, wear a mask. Criteria says that. If you're sick, stay home. Wash your hands frequently. The list has been consistent from the very beginning. And actually, the mask mandate, yes and no, hasn't been consistent from the very beginning. But the information about staying home when you're sick, cover your cough, wash your hands often, disinfect areas that you use frequently, and if you can't social distance, wear a mask. And so I believe that that is the end goal and that we can get there without a mask mandate. And I believe that, and that's what I'm going to consistently do. And I trust Iowans to do the right thing, and I think they are doing the right thing.
Iowa, North Dakota, and South Dakota are 3 states that lead us in virus spread, and those are 3 states where governors don't have mask mandates. Do you
But
think
it
there's a correlation?
fluctuates. It's a snapshot in time. David, I can go right back to, I know where those positive cases are coming from. Let's see, it's 18 to 24-year-olds. 90% of the cases, positive cases in Story County was 18 to 40-year-olds. 87 in Johnson. Through the contact tracing, we can tie to what they're doing. It's congregate settings. It's getting together. When they're socializing and doing what they're doing, they're not necessarily wearing a mask. So, you know, we know, and we're not seeing that impact our hospitalization either. Those kids aren't going to the hospital. What I'm concerned about, though, is when we start to see the increase in virus activity in the community, then if it starts to impact our healthcare workforce, then it starts to become a problem, or our educators, or our first responders, or our CNAs, or our, you know, that are working in our long-term care facilities. Once we start to see that starting to happen, we have to think about what we're doing. And so, again, encourage people to wear them if you can't social distance. Businesses have the opportunity to mandate that, and I think we're seeing, I think people are doing the right thing. I think I answered.